updated once there are any developments on that particular end. But allow us to shift focus to matters health. And it's all to do with the devolution conference that is ongoing in Eldoret from the 15th to the 19th of August, that provides a platform for local governments to discuss and deliberate on their roles in unlocking solutions and challenges affecting the communities. This year's theme is all to do with 10 years of devolution, the present and the future. Now get this, day 2 and day 3 of the conference will see the health sector focus under the theme Celebrating a Decade of County-Led Service Delivery, Lessons for the Future, with the sub-theme of repositioning primary healthcare as a driver for universal health coverage and economic growth. So it goes without saying, Kenya has made tremendous strides in terms of health being a devolved function, but are there misses in spite of the hits? We just want to take a look at the journey thus far of health as a devolved function. And joining me in studio to deliberate on these matters and more, I'm joined by Dr. Willie Sakwale, who is a renowned medic and a special advisor at the Kenya and Malaria Council. Daktari, thank you so much for your time.
Thank you very much, Rogers.
We're equally joined via way of phone by Ms. Elizabeth Ntonjira, who's the Communications and Engagement Director at Women Lift Health and the Zero Malaria Campaign Coalition co-chair. Well, gentlemen and lady, thank you for your time. And I think we can just start with you, Daktari, perhaps reflecting on what has been said so far. Yesterday, we had President William Ruto speak, and he actually mentioned that within 60 days, they'll have transferred all county functions to the respective counties from the national government. And health being a devolved function, this definitely touches on the health sector as well, because a lot of resources are set to go to the counties. Talk to us about the technicalities that need to be considered within these 60 days as we make that all-important shift, transferring these services to the counties where they should be.
Okay. Yeah, thank you very much, Rogers. And what I can start by saying is that I think it was a very good idea to devolve health services. Because health can be as local as it can be. I remember as a young medic almost 30 years ago, there were certain things as I worked in the districts then that I used to wonder, why should I wake up in the morning and call Nairobi to give me tetanus toxoid? I worked in counties, for example, where at the end of the month, people celebrate and cut each other and fight. Sutures and tetanus toxoid would be what is required. I then moved to a county where malnutrition was such a big thing. Then I also worked in counties where the state of hygiene was low, the districts then. And I reflected on overall health. And if you look at health, there are three broad categories. What we call preventive, promotive, curative, and rehabilitative. Preventive, promotive, curative, and rehabilitative. And a lot of focus was on curative. And curative can take all the money. But prevention, as the old adage says, goes, prevention is better than cure. And there was very little effort, like the thing I'm talking about, malnutrition and other things, can get local solutions. So when the new constitution came and the idea of devolution came, I said, we can broadly look at this, but they cannot work in isolation. You need policy, you need clear strategy, you need to monitor what you are getting, but then most important, you need to implement what needs to be done, and that's the service delivery. And that's where the counties come. They must implement, but under very clear and informed policies, very clear strategies. And that over a period of time, you need to continue monitoring some of your key indicators to know whether you are having a public health impact and whether you are saving lives. That's even more important, whether fewer people are getting sick.
Well, that's important. Well, the journey is definitely cut out for us in terms of implementation of some of the policies that have been put down. But in a general point of view, 10 years of devolution, how's the journey been for the health sector? And some of the challenges that have been mentioned time and time again, are they systemic, or are these just teething problems, since 10 years is quite a short amount of time if you look at it?
Yeah. Yes, let me say the devolution of health services was definitely not going to be an event. It is something that was going to take time, but it needed purpose and it needed determination to ensure that it works. And for me, some of the key drivers of health would be financial resources, very key to ensure that devolution works. Human capital. You need the right skills, you need people who are trained, you need the right numbers to ensure that then these services are provided. You also need what you want to call availability of the health products and technologies. You need the medicines, the basic medicines need to be there. And more important, then you need to have a very clear linkage with the community so that prevention is prioritized.
Okay, and what's the weakest link out of each and every point you've mentioned, from technology, human resource, as it is right now? Where should we definitely focus on in terms of pulling our socks?
In my considered opinion, and as I've said, 30 years, I've worked at the Ministry of Health, I've worked in other organizations. I would really look at two aspects, really, and that is financing health. Where does the money come from? How much do we need to deliver a certain package? I don't think we've had adequate resources to fully finance health. And I also look at human resources, the number of qualified personnel we have working right down up to the level 1 and 2 facilities. I don't think we also have those in adequate numbers. So if we can start getting that mix and investing there, then we are likely to go far.
Okay, and I'll come back to you with the health workers' performance and all to do with the performance manager and if it's needed to be implemented. But let's bring in our other guest who's joining us via way of phone, Elizabeth Ntonjira, who's the Communications and Engagement Director at Women Lift Health and the Zero Malaria Campaign Coalition co-chair. Elizabeth, I hope you can get me loud and clear. I understand you're coming to us live from Eldoret. Perhaps break down for us some of the expectations around 10 years of devolution, specifically focused on health. And even as you give us your take, kindly highlight some of the challenges. I know you work closely in terms of combating malaria in the country. Break down the progress and efforts that have been made so far.
DP, yes, I'm coming to you live from the Devolution Conference. And just as Dr. has articulated, has been significant progress, but still there are challenges along the way. When it comes to the fight along the proverb, the African proverb, it takes a responsible, not just the government. So government, society organizations, private sector, the media, the youth and community have to work together, all effectively to win this fight against malaria. More importantly, it will take national and county leaders to ensure that we have a malaria-free community and country. Now, the work that we've been doing at the Zero Malaria Campaign Coalition, which you rightly put the co-chair, is one of the driving forces in Kenya for sustainable change, working together with the government's national malaria program that has been doing an outstanding job, bringing together leading actors in the fight against malaria. Now, you asked me what have been the challenges. There's still quite a number of significant challenges. When you think about the fact that about 63% of activities in national malaria strategic plans in Africa are currently underfunded. And I think Dr. did allude to this, that it takes funding, it takes money, it takes financial resources to actually, on a trajectory to achieve universal health coverage, increase sustainable domestic resource mobilization efforts, not just for ending malaria, but also other diseases will make a significant contribution to, our road to achieving universal health coverage.
Okay, Ntonjira, as we continue, and just briefly, break to us the role of communication and advocacy when it comes to the fight against certain diseases, including malaria, for example.
Oh, wow. The potential, we cannot do anything without communication. And that came really to life when we were fighting the pandemic, the COVID-19 pandemic. There was a lot of misinformation and disinformation. When it comes to malaria and also combating other diseases, awareness building, support and action really play a critical role, and that's the foundation of communication. It inspires and builds off the success of zero grassroots campaigns. I can use an example of malaria that has been on, there's been a campaign ongoing on Zero Malaria Starts With Me in Kenya. And the communications campaign delivers a public mandate and political buy-in to cover issues to do with awareness creation, build the goodwill from the government and the accountability for delivering the 2030 zero malaria commitment. You know, communication boosts the profile of, you know, the issues that you're talking about, the diseases. And as Daktari had articulated, there are three ways, you know, there's the preventive, curative, and, you know, communication plays a critical role in preventive, where people cannot protect themselves from something that they do not know. So that's where communication, advocacy, campaigns come in. I think that's the critical role that communication and advocacy plays. When we have this going to the grassroots level, tailoring the messaging and the advocacy around certain diseases to suit the different communities that we are targeting, the different demographics that we are targeting, using the appropriate channels for the communications that we want to deliver. I think if I can just mention, you know, a lot of the challenges when it comes to communications, people think it's a one-shoe-fits-all kind of approach. And one of the things, I'll give an example with the pandemic. When we were combating the pandemic, we had communication like, you know, maintain social distance, wash your hands with running water for 30 seconds with stove. You know, you have to put on a mask. But people did not really go back to the drawing board and ask themselves, can the people in this, at the community level, at the peri-urban, at the rural areas, are they able to afford these sanitizers? Are they able to social distance? How do you social distance in an informal settlement where there are 8 to 10 people living in a household? So those are some of the blind spots that a lot of people miss out on. And this comes because, you know, communication and advocacy is always an afterthought. I think it's really critical for any person who's, you know, deliberate and intentional on ending endemics and pandemics to ensure that communications folks have a seat at the table. They tailor the messaging so it can get to the right people so that they can make the appropriate action. And we've seen this with our Zero Malaria campaign that we've been doing. Once you get it to the grassroots, once you get the communities involved, once you get their buy-in, everybody is able to protect themselves. It becomes so much easier playing that preventative role.
Elise, just stay on the line with us. Allow us to go back to Daktari and perhaps talk about ways of improving the health workers' performance across the 47 counties. Now, Daktari, performance managers have been touted as a way of improving service delivery and access of quality healthcare within the counties. What more needs to be done to enhance service delivery? Because as you mentioned, the healthcare workers are very important cog in this health sector.
Okay, thank you very much for that question. And that's a very critical component of the quality of healthcare. Yes, and you are right. Let's not just say we've devolved health for the sake of it. We must also improve the quality of the service. We must improve the quality of what we do. And the way I look at it, therefore, is that we have what we call Kenya Quality Model, which has been there for a long time. And we would want to see that this is something that is improved on. You need a structure that starts defining certain indicators. In these indicators, you look at quality management sub-indicators. So, number one, if there is a quality of service to deliver this delivery of malaria case management, you want to treat malaria, you have a component where you need to do diagnosis properly. You have a component where you want to ensure that there is a policy and a strategy that delivers on what is used for treatment.
Okay.
You have something that ensures then there's a monitoring after you've treated somebody. So what you call a quality management kind of infrastructure would be very core, and within it, therefore, you want to ensure that everybody up the ladder, not just the managers, the people doing service delivery. If we are using community health promoters, what do we expect in terms of quality of service? Not that they are just there to do something, but they must provide quality service. So you have very clear guidelines, and that brings in the issue of capacity building, the issue of training. Unless you do proper training and capacity building, you will never achieve quality care. So that is something that therefore needs to be done. We are hoping that this is going to be part of the journey that we start as we now move towards equipping and training of community health promoters. And then there has to be a kind of supervision and mentorship. The people above must ensure they go and see what kind of service, they pick the weaknesses, they do continuous capacity building, they bring in new technologies, including use of digital health to train and monitor what is happening. And for me then, new skills can be incorporated on a needs basis. So in brief, what I'm saying, the issue of quality care with the components that ensure it is there should be a key focus as we move forward in the evolution of healthcare.
Well, and a lot will be discussed in these 2 days that health will be focused on, especially since it's a devolved function. I'd just like us to perhaps go back to, these functions actually being devolved, being removed from the ministry, talk about the Ministry of Health and whatnot. The earlier conversation was the functions have been devolved, but money hasn't followed. So now that we have the assurance from the president that money will follow these functions to the counties, what exactly should we do to ensure that the intended purpose, the money is used for intended purposes? Because, talk of corruption being devolved as well has been rife. And right now we have more money going to the counties. How do we ensure that the health sector is actually boosted by this jump in funds to the counties who will be managing? What should we do?
What we need to do is to cost some of the key services. What does it take to prevent malaria? What does it take to treat diarrhea? What does it take to undertake a surgery? Once we have guidance, and some of these have been costed, and it is in a public domain, that a cesarean section will cost this if it is undertaken. Treatment for malaria, the diagnosis is this. Then when these monies go, it is very clear that there is a guidance that can be monitored. So if you treated 100 people of malaria, it cost this. If you did this, it cost this. To me, that is from where I sit and the experience I have, that would be a core thing that needs to be done.
Okay, well noted. Allow us to converse just briefly as we finalize with Ntonjira, who's still on phone. Efforts have been made and progress has been made in terms of combating malaria and ensuring that the health services are enhanced within the counties. Talk to us about who exactly is involved in, the fight against malaria, and what exactly is their role in this whole ecosystem towards achieving that all-important purpose.
Absolutely. I just want to, just before I get to that question, I want to add on to something that Terry did mention around the role of community health workers and the critical role they play. During the 2018-2020 Ebola outbreaks in DRC, the WHO, UNICEF, and other partners used communication specialists to engage with communities, to raise awareness about Ebola vaccination campaigns and to provide, information on prevention of transmission. And this kind of, permeates from the earlier question you'd asked me around the role of communication. Similarly, India's social mobilization network played a key role in eliminating polio in the country, and has over time and has been used as a case study as one of the most successful, public health platforms for engaging communities. So, it's really critical, just as Daktari said, we engage communities and everybody within the stakeholder network is involved, which takes me to your question of who is involved. Everyone is involved. You, me, the civil society groups, the youth, the trade associations, the religious associations, the policymakers, the legislators, everyone within the ecosystem is involved in this fight against malaria. Malaria still kills a child every minute. We've been in this conversation, I'm not too sure for how long. If it's 17 minutes, the ghastly reality is that 17 children have died of malaria as we are speaking. And if we take our foot off the pedal now, further hard-fought progress could be lost, disproportionately affecting women and children.
Okay, Ntonjira, allow me to cut you short right there.
Awareness, yes.
Okay, thank you. You definitely articulated some of the stakeholders in this collective fight against malaria towards enhancing devolved health functions. And thanks for your contribution right there. She was joining us all the way from Eldoret via way of phone. She is the Zero Malaria Campaign Coalition co-chair, Elizabeth Ntonjira. Thanks for your time. Daktari, we've come to the end of the discussion due to time, but definitely this is a journey. It's a marathon. It's not a sprint. A lot needs to be done to enhance health as a devolved function.
Absolutely. And I think it's the responsibility of everyone.
Okay.
And we are looking forward with towards the devolution of all the remaining functions.
All right.
It is going to be a busy time, but I think it's for the benefit of Kenyans.
Asante sana for your time, Daktari. Dr. Willis Akwale joining us in studio, renowned medic and the special advisor of Kenya and Malaria Council. Allow us to shift focus